Hi, my name is Cori. I'm going to be your nurse today. Hi. I'm just going to clean my hands for 40 to 60 seconds to prevent the spread of infection. And I'm going to shut this door to provide you with privacy. Can I just see your name tag? What's your name?
John.
And the first and last, please.
Doe.
And your date of birth?
1101.
And what's your, how old are you?
25.
Do you know where you are right now?
I do.
Where are you?
The hospital.
Okay, and do you know the date today?
March 1st, 2018.
And do you know who the president is?
Donald Trump.
Okay, so the patient is awake, alert, and oriented times 4. The patient appears to be of stated age. The facial features are symmetric, no signs of distress. The speech is calm and clear and organized. The patient is calm, dressed for the occasion appropriately. Why are you here today?
Checkup.
For a checkup? And when was the last time that you had a checkup?
3 months ago.
And has anything changed since then?
No.
Do you have any allergies?
No.
Do you take any medications at home?
No.
Do you take any over-the-counter or
No.
herbal supplements? Have you traveled in the last 30 days?
I have not.
Okay. I'd just like you to step over here, and I'm going to take your height and weight. Okay. So your height is 5'7". Your weight is 141. And this would give you a BMI, body mass index, of 22.1. Body mass index is a recommendation from the CDC on the it's a recommendation of the weight based on your height. The scale is for normal. The normal recommendation for adults is between 18.5 and 24.9, and your BMI was 22.1, so that falls within that scale. Under the 18.5 would be considered underweight or undernourished, and over the 24.9 would be overweight, and over 30 would be considered obese. Some notes about over and undernutrition. Undernutrition can be caused by lack of access to food, dental caries, chronic disease. This can have a profound effect on children, growth and development cycle, and on adults it can cause brittle bones, loss of skeletal muscle, and even increased risk for mortality. Overnutrition can cause serious problems with the body, type 2 diabetes, and cardiovascular disease, and it can be caused by overconsumption of fats, sugars, and calories, as well as just plain overeating, alcoholism, and lack of knowledge, a knowledge deficit. As you walked over to the scale, I noticed your gait. Your gait was even and well balanced. The neck holds the head erect. You stood and sat comfortably. I want to test your cognition at the end of the exam, so I'd like you to remember the height and weight and BMI that I told you, 5'7", 141, 22.1, as well as the word rubber and ducky. And I'll ask you that at the end. And I just want you to recall at least 3 of those. Okay. Now I'm going to take your vital signs. First, I'm going to take your blood pressure. So I would put this blood pressure cuff on your arm, just above the fold of the arm, and place my stethoscope here in the brachial pulse. And I would like it to be something between the normal range, which is 120 over 80 and below. Anything over 120 over 80 would be considered pre-hypertension to a diagnosis of hypertension and even a hypertensive crisis with a systolic over 180. Also, I'd like to take your pulse. So the main pulses of the body can be found here at the carotid, at the radial, the brachial, the femoral, just here in the fold of the leg, the popliteal, just here behind the knee, up on the top of the foot, the pedal pulse, and the dorsalis pedis, and right here at the back of the ankle, we have the posterior tibialis. Right now I'm going to take your radial pulse. So I'm just going to grasp both wrists at the radial pulse, and using my wristwatch, I'm going to count the pulsations in 30 seconds and double that for a pulse reading of 1 minute. The normal pulse. Normal pulse is between 60 and 100. Anything lower than 60, we would call that bradycardia. The only reason why it would be lower is found to be lower in athletes. They have a more efficient cardiovascular system, and above 100 would be tachycardia. Your pulse that I just took was 66, and this is normal in an adult between 60 and 100. As I was taking your pulse, I was also noticing the rise and fall of the chest. The breaths were regular, unlabored, no use of accessory muscles. There were no, with the shirt on, there were no, there was no evidence of intercostal muscle use. However, I did get 14, so this is normal. In adults, respirations per minute would be 12 to 20. Below 12 would be bradypnea, and above 20, we would call that tachypnea. And yours was a normal reading. Also want to take your temperature. I would put a thermometer under your tongue all the way to the back. This is the oral temperature route, and the normal reading for oral would be 37 degrees. Excuse me. The oral, which would be inside of the ear, we would be a higher temperature. Normal would be a higher temperature reading, and that would be 37.6. The most effective temperature would be the rectal temperature, and rectal is also a higher temperature reading. It should be 37.6 around as well. And then you would also have the axillary, which is the least effective, and axillary reading is 36.3. It's a lower reading. Normal is lower. I also would take your pulse oximetry. It's a small device placed on the finger over the nail. It should be an unpainted nail. And the normal reading for pulse oximetry showing the oxygenation of the blood would be 95 to 100%. The fifth vital sign, we call that the pain vital sign. I'm going to use the numeric scale on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain you've ever experienced. How much pain are you in right now?
0.
0. And then we also have another pain method. We have several, but one would be the Wong-Baker faces. So the Wong-Baker is a series of faces. 0 would be a nice happy face, and then going up to 10, which would be a very sad crying face, and then you would show these series of faces to the patient, and the patient can point to which face would depict the pain that they're experiencing. And this is often used in children, but it can also be used in patients that aren't able to speak and tell what kind of pain that they're feeling. We also have an acronym that we use to assess pain. It's the Old Cart and ICE acronym. Old Cart, so some of the questions that represents are onset, so when did the pain start? Location, so where is the pain? D is duration, how long has this pain been happening? The impact on your activities of daily living, is it impacting your daily living? The emotional response. So what sort of emotional response is this pain causing you? Your coping mechanisms. What are you using to help you to deal with the pain? So at this time I want to go ahead and do your skin assessment. When I look at the skin is even, is consistent with the ethnicity. There's no signs of cyanosis, bluing of the skin, which would be some signs of poor perfusion. There's no ecchymosis, which are like bruising-like spots, which would represent a cell abnormality. And so I don't see any of these evident on this skin. Now I want to go ahead and palpate your skin. Also, I don't see any lesions, any moles, rashes. I'm going to go ahead and feel your skin for moisture and dryness, moisture and temperature. Okay, just going to feel your skin. Feeling the hands for moisture. Feeling the temperature of the legs and the temperature of the feet. And the temperature of the feet are even bilaterally. The skin is warm and dry. This represents that there's good perfusion of the skin. The feet temperature were even bilaterally, and this represents that there is not arterial perfusion problems. Difficulty perfusing the feet would be evident by different temperatures of the leg, indicating that there's an arterial issue. And this was not evident here. While I was also feeling the legs, I was also feeling the if there were any edema present on the feet. Also checking the sacrum for edema, the hands, and the orbits of the eyes. There was no edema present. Edema is assessed in a scale of +1 to +4, with +1 being a 2 centimeter depression when palpating for edema, of the depression left in the like an indentation in the skin, and that's going up to 4 and increasing by 2 centimeters with an 8 centimeter depression. Another item I wanted to notate when I spoke about your pulse was that it was a regular pulse, even on both sides, and that it was a +2 pulse. So there's another scale that we use for pulse, and that would be a 0 to 4 scale. So 0 would be no pulse, +1 would be a weak, thready pulse, +2 is a normal pulse, +3 would be a increased pulse, and +4 would be a bounding pulse. So this was a normal pulse observed in this gentleman. Now I just want to go ahead and check your nails, actually. So looking at the nails are strong and no signs of brittle nails or peeling or scaling, and so the nails look good. It's a capillary refill bilaterally of less than 3 seconds. If you can place the dorsal aspects of your fingers together, and then I'm just going to check for clubbing, and we look for the diamond formed by the 2 nail beds not touching each other. A small diamond forms in the middle. Were the nail beds to bow out and the rims of the nails not touch in this way, that would be an indication of clubbing. And so the clubbing is not seen here, and clubbing would be an abnormal finding. Now I just want to go ahead and check your head, your hair. The hair is brown, medium length, it's thick, and I'm just looking for any signs of infestation, any nits in the hair, and there's no infestation evident. Any signs of missing patches, no missing patches. I just want to go ahead while I'm here and palpate your head. No lumps or bumps. Let me know if you feel any tenderness when I'm touching you. And there's the head is normocephalic. No lumps or tenderness. I'm also going to go ahead and start on the head assessment. So looking at the head, and this time I would also provide hand hygiene again for 40 to 60 seconds to prevent infection. Palpating the sinuses. Let me know if there's any tenderness. Observing the carotid pulse. The temporal pulse. And the temporal pulse is smooth, which is an expected finding. I just want to place my hands here on the temporal mandibular joint. Have you open and close your jaw, and the jaw opens and closes without clicking noises, and this is an expected finding. I'm also going to point out the lymph nodes. So here we have the pre-auricular node, the post-auricular node, the occipital node, the deep cervical chain, the superficial cervical chain, the tonsillar node, the submandibular, and the submental. And here is the supraclavicular node right here. Now I'm going to check for tracheal deviation. And no tracheal deviation is notated. I'm going to give you this glass of water and checking for palpating the thyroid gland to see if there's any enlargement. I'm going to ask you to turn your head to the side. That's right. Take a sip. And pressing the trachea to the side, and the thyroid is not palpable upon palpation, and this is an expected finding. An enlarged palpable thyroid gland is an abnormal finding. Another assessment that we can do while we're here is inspecting the carotid pulse. I don't see any pulsations while I'm looking at the carotid pulse, and then with the bell of my stethoscope, I'm just going to listen to it. Take a deep breath, that's right, and breathe out, and hold. And there's no whooshing noise heard, and so there's no bruit on exams heard. And a bruit would be an indication that there is risk for stroke and narrowing of the artery. And this was not heard. Another thing we would check is the for jugular vein distension. And this is not an exam that I'm going to be doing, but I would have the patient lay back at 45 degrees. Place a metric ruler here at the angle of Louis and vertically, and another horizontally across to the jugular vein, and then the ruler would be lifted up to the top of the jugular vein, and the reading for the measurement read on the vertical ruler. And we want that reading to be less than 3 centimeters. Anything more would indicate jugular vein distension. At this time, also I'd like to point out the pulses. I think I did the pulses actually, but I'll do it again. So we have the temporal pulse, the carotid pulse, the brachial pulse, the radial pulse. Here we have the popliteal pulse, the posterior tibialis, and the pedal pulse on the top of the leg. If you can just remove your shirt, and we'll go ahead and start the thorax and lung assessment. So looking at the chest, there's no heaving, and the chest rise and falls at a normal regular tone, the muscles coordinating well. Also looking at the chest, I see no signs of pallor, cyanosis. The transverse diameter, it seems to be 2 to 1 to the anterior posterior diameter. And at this time, if you can just stand up so we can do a inspection on the posterior chest. So just looking at the chest, we can see that the chest rises and falls bilaterally. Actually, just turn this way. Yeah. And the chest rises and falls evenly bilaterally. I'm going to ask you to go ahead and take a deep breath. And there's even chest rise and fall. Now I'm going to ask you to repeat the words 99 as I palpate your chest. That's right, just lean forward, shoulders forward, and go ahead and say the word 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
So this is a test for fremitus. Fremitus is feeling the pulsations in the lung fields. It would be increased in the tracheal area, decreasing as we get into the bronchioles, and diminished into the alveoli areas of the lung fields. An increase in fremitus would be an indication that there might be fluid or infection in the lungs. Now I'm going to do my percussion part of the exam. And the percussion, we'd expect on the lung fields for there to be resonance, and over the bones, or if there were any tumor or pleural effusions in the lung, you would feel a dull sound. And I did feel resonance in the lung fields and no dullness. Now, at this time, I'm going to proceed with the auscultation of the lung fields. I'm going to ask you to go ahead and breathe normally throughout this part of the exam, and let me know if we do need to stop. Deep breath. And the lungs are clear and equal bilaterally. One part of the skin assessment that I wanted to go over is the skin cancer assessment. And you can just turn back around. The skin cancer assessment, I would ask you about any moles or lesions or birthmarks, any changes in them, anything new that you have going on. And we use the ABCDE assessment tool, and that would be looking at asymmetry, border, color, diameter, and evolving changes of any of those items, and that's how we would assess that. Additionally, for sun cancer, I would ask you questions like, do you work outside? Do you wear sunscreen? Have you ever had a sunburn that resulted in blistering? We recommend, to prevent sun cancer, that you wear SPF 15 sunscreen or above. You reapply throughout the day. You avoid midday sun. Wear a large brimmed hat, and wear sun protective clothing. At this time, I want to go ahead and do the cardiac assessment. First, I would inspect the chest. There's no signs of pallor cyanosis on the chest, no obvious pulsations on the chest, and this is a normal finding. And now I will palpate the 5 points of the pulses. So going to the second intercostal space on the right sternal border, here we have the aortic pulse, the aortic valve pulse. This is the pulmonic. The third intercostal space would be the Erb's point. The fourth intercostal space, here we have the tricuspid. And then the fifth intercostal space, mid-clavicular line, we have the point of maximal impulse. And now I'm going to auscultate these points. The aortic and the pulmonic, S2 is greater than S1. At the third intercostal space, I'm here at Erb's point. S1 and S2 are equal. The fourth intercostal space, the tricuspid valve, S1 is greater than S2. Fifth intercostal space, mid-clavicular line, the point of maximal impulse, S1 greater than S2. At this time, I would like to do the peripheral vascular system assessment. We pretty much covered it earlier, talking about edema and the various pulses of the body. We also notate the hair growth is equal bilaterally on the peripheral, and any unequal hair growth would indicate peripheral vascular disease, could indicate that. The temperature of the feet we spoke about earlier. Any ulcerations on the legs we would indicate arterial or venous insufficiency, depending on the location. Also, there were two sounds I'd like to talk to you. There are some abnormal sounds. So we have the adventitious breath sounds. Fine rales would be an unexpected finding during the thorax and lung assessment. If you were to hear adventitious, a fine rale is a high-pitched crackling noise, and it's heard on inspiration, and it would be caused by collapsed or open fluid-filled alveoli. Also, there could be wheezing. Wheezing would be heard on expiration. It's a high-pitched, continuous sound, and it is caused by asthma or infection or foreign body obstruction. The extra heart sounds. So we talked about S1 and S2, but we also have S3 and S4, murmurs and gallops. Murmurs are caused by stenotic valves. Murmurs are a whooshing noise, and murmurs are, and S3 is heard during the filling of diastole, and it is caused by, it is seen in young children, young adults, children, and pregnant women, or it could be a sign of disease. S4 is usually always a sign of disease, and it is also heard in diastole. I believe that this concludes the assessment.
My 3 words?
Yes, thank you.
Yes.
And please, the 5 words that I ask you to give, what are the 3?
141, 22.1, and rubber ducky.
You remember all of them.
Yes.
And so this is a good sign of cognitive memory, cognitive function and memory.